Hi, good morning, all. I hope you all are doing well. Thank you for joining us today for our webinar on partnering with faith communities. As we begin this morning, I do want to give just a couple quick disclaimers. The presentation was prepared by INTAC under a cooperative agreement from SAMHSA. Any views that are or perspectives that are shared don't necessarily represent the views, nor are an endorsement of SAMHSA, HHS, or the US government. And in the case that we have any kind of security issues that may occur, the session will immediately end and will not resume until using that same join link. And so at that point, a separate email will be sent to all participants with further instructions for what to expect. And then before we begin, I also just want to give a quick overview of INTAC. So INTAC is a multidisciplinary team that consists of a number of partners. Those include the Center for Applied Research Solutions, Georgetown University Center for Child and Human Development, Change Matrix, MedStar Georgetown University Hospital, the American Academy of Pediatrics, FREDLA, Youth Move National, and the University of Texas at Austin in the Texas Institute for Excellence in Mental Health. And our mission is that all children, youth, young adults, and families with emotional or behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. And so when we look at who we do serve a wide array of key cross-sector audiences. Some of those audiences include state and local agency leaders, the mental health workforce, primary care providers, the school workforce, community-based providers, peer supervisors, family partners, and youth partners. And at INTAC, we're proud to be able to offer no-cost training, technical assistance, and resources. Off to your right, you'll see some of those examples of things that we offer, which include individual consultation, peer learning exchanges, customized coaching, training academies, communities of practice, My Things Digest, podcasts, practical tools, and more. And today I'm proud to be able to present alongside Michael Cox. I'll let Michael introduce himself, and we'll begin with mostly some real informal conversation. We're a little bit of a small group this morning, but looking forward to this conversation and seeing what we can do. And so I'll turn it over to Michael and let Michael introduce himself, and then we'll just kind of have some loose conversation and kind of talk about what this looks like.
Hello, everyone. David, I'm looking on there and seeing it's LPCS, not LPCC, just so that I don't confuse people. But my name is Michael Cox. I am the owner of Whole Life Priorities, which is a counseling center, counseling, training, consulting, do a few different things. And I live in the Austin area where I run that private practice, married to a wonderful educator with 3 young boys.
And so again, you all know me. My name is David McClung. I work as a research associate with UT Austin, and I'm proud to be a part of this INTAC team. So today, what we've been doing, just to kind of give you a quick agenda overview. So some of the things that we have been looking at in this conversation over the last couple months is the role of faith communities within systems of care. And one of the things that we've talked about is this idea that faith communities really have a lot to offer and are really sort of critical partners in the way that we think about systems of care. And some of the reasons for that include this idea and this knowledge that clergy are often consulted at higher rates for mental health challenges than what we may even find with psychiatrists or general medical doctors. And so with that, then there becomes a responsibility within systems of care for us to be able to find ways to partner with faith communities. And at the same time, in doing so, we're really able to kind of provide a more culturally responsive approach when working with individuals, because we're sensitive and attuned to and tuned into those understandings of where those individuals find meaning and where they find purpose, and the ways that counseling may be delivered or that other services can be delivered in a way that really is culturally responsive and that really meets their needs and is coming from where they are, rather than simply trying to exert new ideas or new understandings without first trying to understand where they're coming from. And so as we begin this conversation, I'm actually going to turn off my screen sharing. The goal for today is to be able to provide some concrete strategies for being able to build these strong partnerships. And we'll make sure we do that. But before we do, I'm hoping that we can, again, just kind of have an open conversation. And so that Conversation is open. If you have thoughts, ideas, feel free to put that in chat. And in the meantime, I'll just start Michael and I off and we can go from there. Michael, it's good to meet with you today. I really appreciate your willingness to share your expertise and your wisdom on this topic. Just to kind of start us off, I'm wondering if you can talk a little bit about the role that you see faith playing in the lives of the children, youth, and families who you work with.
So I think it varies. Those who come from a faith background, it's usually very integral, right? And so sometimes when someone is coming into my practice seeking out therapy, if faith is a strong part of who they are, that's usually the first thing they tell me is that whatever their faith practice may be, they will tell me, this is very much a part of who I am, and I would appreciate if you incorporate it into the process. And so it's pretty interesting to see maybe the polars, because sometimes if someone's not of faith practice and they see my background, they're also very adamant to let me know that they don't have a faith practice and don't want it to be a part of their therapy. So it's depending on the individual and their treatment, but those who where faith is a part of their life and a strong part of their life want it to be a very integral part of who they are, and oftentimes want me to consult, whether it's with a pastor or a leader or someone in their faith community, to be a part of the process for them.
Great, thank you, Michael. So you did allude some to some of your background, and I'm wondering if you don't mind just kind of sharing that for those who may not be familiar with you or some of the work that you're doing.
Yeah. So I was a pastor or minister for 13 years prior to going back to school and get my degree in counseling. And so a lot of that work was done in churches and missions, working with adolescents and their families. And I'm still a very active part of my own faith community now, and have been since I was vocationally in ministry, but partner with a number of different pastors and churches to whether it's training or being a referral source, or I'm a former system of care worker.
So I think that's really one of the reasons why I'm so excited that we're able to have this conversation today, Michael, is that you have these various perspectives and you're able to bring those together into a really solid picture that allows for us to really kind of have this conversation in some unique ways that I think are, maybe hard to find with others. And so I'm curious, when you think about what it was like in your pastoring work, or what are the things that maybe you were seeing inside of your church and maybe in your own sense of calling that you said, okay, hey, mental health is something that I need to be able to have a better understanding of, or that I want to be able to pursue?
A little bit of background with that is my undergraduate degree is in religious studies. And when I finished that undergraduate degree, I always knew at some level I wanted to go either social ministry or something. And so there's kind of a desire to either look at social work, counseling, or something like that. And so a lot of my work, even when I was working in churches, a lot of that happened outside of the walls of the church, and connecting with people, whether it was on mission trips or just doing community ministry. And it seemed like that was just where I was constantly drawn. And in addition to that, I oftentimes would have, especially young people, that would come to me that were experiencing just extreme levels of difficulty. And to be honest, it didn't feel like prayer was enough. Like they were part of that process, and maybe even going through their Bible and working through those things in discipleship was a part of it, but they were experiencing deeper things and trying to figure out how to deal with that. I felt completely unequipped. I got told numerous times that, hey, you're doing ministry, you are doing social work, you are doing social ministry, which was to a degree true, but felt like I was ill-equipped. I felt like I could pray with someone. I felt like I could walk them through the Bible or whatever it may be, and felt like that was needed. But there was more that I felt like I could offer, and that was being asked of me, and didn't feel like I was equipped to do it. And so that's when I decided I need to go back to school and decide and went the track that I did and get my counseling degree. Just because I saw the need. I mean, the need was there, and it wasn't saying that the church didn't have a place or that it wasn't impacting, but to see that there were needs that were there and the church was not equipped. I can tell you that outside of my own looking, I never heard any mention of mental health. I never heard any mention of any of that in the church setting. Yet we had so many people struggling and dealing with things that weren't being addressed. And so I just personally felt compelled to go and figure out what my part was in the process and go do that. And now having the background with the church, being able to partner with them to help them minister or to connect and work to other folks experiencing similar problems, whether it's the ministers themselves and leadership or to their congregants or equipping them to be able to help within their congregations or faith practices to help them out.
I really appreciate that. So when you think back, you mentioned that it really took a level of initiative in being able to kind of find these resources and to be able to gain that knowledge, and that you were able to do so. I'm curious, when you think about some of the types of resources or the things that you wish had been available during that time as a minister, what are some of those tools, or what are some of those instances where as you look back, you would say, man, I really wish I had fill in the blank?
Education and awareness would have been the very first thing, is to know what I didn't know. Like I felt I was fulfilling my call as a minister and doing those things, but no one in undergraduate school and being prepared as a minister, no one talked to me about how to address suicide or suicidal ideation. No one talked to me about when a young person is experiencing self-harming behaviors or engaging in those. No one ever told me about it, but I had teenagers coming to me dealing with this stuff. And so it'd have been really nice if someone is just giving me a level of education and awareness, and to the level that was needed, right? For me as a minister to say, hey, you are in the public, you are in the field with folks are going to be coming to you, and here is some education and some awareness about what to do with that. Additionally, having partnerships. Like, I don't remember, not to the fault of anyone or myself even, I don't remember having a connection to other therapists other than the therapist I saw. And so to have a partnership with someone that, when I, as a minister, felt like I had reached my abilities, the limit of my abilities, to know I had someone to partner with, to help and trust, to connect my congregants with, that would have been amazing. I think the other end of that is someone helping me understand my limits, right? Is knowing that because of my education, my experience, lack of those things in this field at the time, I probably did, actually, I know I did, took on some things that maybe I wasn't equipped for. Yet I was the person that these young people and their families would come to because I was trusted. And so I did the best that I can. I don't think I did any harm to anyone, but I wish I was better educated on what to do and to know my limits in that role of what I was capable of doing.
Yeah, no, absolutely. And I think you're right. I think there's a lot of ministers who maybe even have counselors, or they have other mental health practitioners and individuals who work within systems of care within their communities of faith, who may not even realize that those resources exist. And so, they're doing daily life with them. They're spending numerous hours a week. They're doing things related to their faith and spiritual practices. But in terms of really being able to then take that and to be able to figure out where are our natural resources as a faith community, and how do we use those to be able to meet the needs of others, so that we have that kind of well-coordinated system of care. It seems like those conversations sometimes break apart, and that those conversations are maybe also difficult at points to be able to have in faith communities. That there's a judgment associated with, hey, if I say I have a mental health challenge, or if I say, hey, my child is going through some substance use challenges, or hey, there's these adverse childhood experiences and this is the effect of trauma, and it's not just poor parenting technique, but this is trauma, then that reaches a point of judgment, and becomes difficult to be able to seek those services out for that.
Yeah, David, I think that makes me think about, I think this is changing, and I think it's evolving. I know it didn't exist when I was a minister, maybe even earlier in my work in mental health, is I don't know that the two systems see that they can work together. So you can think of the concept of system of care, pulling all those that affect a family or children together to work for the betterment of that family. I think those systems see themselves as silos, all right? So the faith community has their job, and the mental health community has their job, whereas we are whole beings and experience all of that. And so I think it's even getting over the hump of realizing, hey, we've got to work together to effectively help families and communities, and all have our own roles and working together to do that. And so I think that's the hard part, is getting over that. But I do think that that's shifting. I do get the chance to talk to a number of pastors, ministers, faith leaders right now, and see individuals who are being more open about their own experiences, whether it's as them as an individual, or the congregants, the folks within their communities experiencing difficulty, and being willing to seek out the help, whether it's for their own individual needs or for partnering and helping support the folks within their community. So I do see it changing, but I think for the long time, it was such a silo of, hey, the faith community do what you need to do, mental health community do what you need to do, and not seeing that those two have to work together.
Partnerships is sometimes a word that I think it's really confusing at points, because partnership, I think we often approach with our own needs, or we approach with our own understanding of this is what I want out of the relationship, rather than really trying to understand there being a mutual benefit. And so I'm wondering if you can talk a little bit about what it looks like to have strong partnerships, or when you think about the faith communities you're working with, what do those partnerships look like? What are those characteristics that maybe make those partnerships effective?
I have to equate it to, I do a lot of work with couples, right? Or partners in the community. And when I'm talking to two individuals who have chosen to be in a relationship with one another, I oftentimes say you both are completely different individuals who have chosen to live life together and to walk this journey together. You bring your own strengths, you bring your own weaknesses, but you both contribute to a partnership, working together to figure out what's the best life we can live together, right? And so I think that's very similar to thinking about whether it's the faith community, mental health community, is both bring very unique skills, abilities, resources to the table, and are very unique entities. However, coming together to serve the community, both of those things together are stronger, right? And figuring out what strengths, weaknesses do we have, and how do those coexist to make for a better community. And so I think it's allowing those communities to realize, what is it? So the reality is, it's not always can you find someone who's an ordained licensed minister, and as well as a licensed professional counselor, right? You can't always find that combination in one individual or even one entity. So what do you do to bring together those needs to help meet the needs of the community, and not realize it's not a competition, but it is an effort to working together for health and wellness of the community. So I think it's just allowing that to really be something that strengthens, to realize it's not a yours or mine, it's just our community, and what are the strengths and abilities we have to bring and working together for a better community.
Yeah, I really appreciate that, Michael. So as I was kind of thinking through some of these things, as I began kind of thinking through some of these conversations, a couple of the things that really kind of stood out to me were characteristics of strong partnerships include things like mutual respect for one another, a willingness to listen even when the thoughts or opinions are different from one's own, just the ability to ask questions, share concerns, a common purpose. It seems sometimes that part of the challenge is, again, there's not a real clear goal. It's, hey, I want to work with you in some capacity, but what it is that we're hoping to accomplish, or how we measure that, or how we show that we're actually meeting that, becomes difficult at times. And so we're doing something, but maybe we don't know what it is that we're doing. And then some other things just include clear understanding of roles, responsibilities, willingness to share resources for the sake of the common goal, consistency in communication and follow through, patience in navigating the work, flexibility to adapt. And then I think I've already mentioned measurable outcomes. And I'm wondering if there's any of those that maybe stick out to you, Michael, when you think about some of those relationships you have.
Honestly, I think some of it becomes language obstacles, like we talked about, trying to figure out how to get on the common purpose. That sometimes it becomes an obstacle because maybe you're not working towards the same goal. And that's where the fight becomes, is the faith community might see that this is our goal and where we're going. This is our goal in the mental health community. And really, wellness, whole beings, healthy beings, is probably where we're headed, but maybe how to get there becomes an obstacle. And then the other is if, sometimes I see measurable outcomes. The hard part is I don't know if you can always know in a faith community, how can you measure growth, right? And have a number to put to that. And so that language can be hard to get on the same page with sometimes because, in this field, it's necessary. I'm not saying it's not, but it's all about hey, how do we put a number on it? And we got to our goal and what's attainable, as opposed to maybe it's more relational in the faith community, and trying to get on the same page with those can be difficult sometimes. And figuring out that we probably do have the same goal, but maybe the language is the barrier. And so being able to get into the same space and talk about what some of those goals are. Because I would go as far as to say, sometimes that happens, even if you look in the faith community, it's hard to have that same common purpose, even just in the faith community, much less getting outside of that and bringing another entity in. And so standing on that common purpose, I think is that place. And what have I seen it look like? Is being able to come in and be more inquisitive about the goals of those faith leaders. What is your goal within your community? And how can I connect, partner with you in reaching that goal? And then being able to share what mine are, right? Because I've even experienced this sometimes in going to talk to faith leaders. They're like, what is your agenda? What is your agenda coming in and wanting to be a part of our faith community, or even reach our people in our faith community? And I think there is an agenda, but realizing that maybe we are more on the same page. And let's just talk about that. But me being more concerned and inquisitive about curious about their goals and desires for the community, and then match what I bring to the table to helping them meet those goals. I see that there's more buy-in that way than it's just coming in, hey, here's my agenda, this is what you need to do, and this is what needs to happen. That's going to get pushed back, because now I'm being told of an outside entity of what to do with my congregants.
Yeah, I think that's a great point. I do think that there is often a lot of, I don't want to say skepticism, but maybe there's wariness of outside organizations or outside providers. And I don't know that that's a bad thing necessarily, but I think what it does is it speaks to the idea that there hasn't been a lot of cross partnership within systems of care with faith communities. And so suddenly when mental health professionals and other parts of the system of care are wanting to be part of what faith communities are doing and trying to find ways to partner, I don't want to say it's surprising, but there's questions, why now? And what is, as you said, what is your agenda? What is it that you're wanting from this? And that sense that, hey, maybe this really is a one-sided partnership or one-sided relationship where you're wanting something from us, as opposed to this really being partnership, kind of comes into mind or comes into play then. And at the same time, I realized that trying to go into faith communities or trying to figure out where to begin is something that can be kind of frightening as well, particularly if maybe I'm not real familiar with that particular congregation or that faith tradition and where they're coming from. I know in my experience, going into certain faith communities has been, I don't want to say challenging, but it's been something that there's been that thought of, hey, what is it that they believe, and how does me going into this place impact their understanding, and what are the things that are important for me to consider as I'm doing that. And so I'm wondering if you can talk a little bit about, if I'm on this webinar today and I'm thinking about where it is that I even begin this conversation. Maybe I'm committed already to being able to go into a faith community. I want to engage with congregations inside of my community, but I really don't know that first step. What are some of those things that you might recommend for strategies for doing so?
One, I think your list that you have on the screen is a good one. There's a good set of strategies. I think the one thing that came to my mind when you were talking a while ago is, I think there's another conversation that maybe feeds into this, is we're talking about the oftentimes the mental health community going into the faith community and wanting to do the work. But I think sometimes the reciprocal is a struggle. Is the mental health community receptive to the faith community coming in? Because is it going to be, you have an agenda now? And so I think it happens both ways, right? And realizing that sometimes maybe the mental health community is trying to push into the faith community and feel resistance. But I think when the faith community wants to be on board, depending on what faith community it is, right? The mental health community may be resistant for legitimate reasons, but there may be some resistance there, right? And so I think both of those, we don't want to paint the picture that the resistance all is in the side of the faith community, because I don't think that that's true. I think it goes the other way. So I think some of the strategies, you can never underestimate networking and connection, right? And so getting to know people, most communities, they're gonna trust those people that they know, right? And so finding out who are the movers, the shakers, the influencers within those communities, not to an agenda just to infiltrate, but as a chance to truly get to learn and know about that community. And if you have something to offer to strengthen that community, there's some trust that's got to be built. That's got to be built in getting into that community, whatever side or whatever community that may be. And so them seeing that there's a benefit for you being a part of that is important. I think the other end of that is identity is huge, right? And knowing like, all right, so we know within the mental health community, I think this is changing, but we're not quite there yet. The majority of folks who are leading the charge is maybe identified Anglo female, and that may not be the person that's going to do the infiltrating in that community. And there's already a stigma maybe towards that individual when it comes to mental health. And so knowing who is the representation that's trying to connect with that community, especially in the faith community, there are different barriers and boundaries around who can communicate, who can we talk to, who has some authority within that community. If we're unaware of those things, we already have a barrier that's there. And so really being familiar and trying to educate yourself the best you can on that community so that when you go forth, you are connecting with the right folks, and being familiar with what they offer, what their needs are, how can you partner.
Yeah, I think one of the things that really sticks out to me as I'm hearing you talk about this, Michael, is this idea that faith communities are very much like people. Organizations are very much like people. They have their own histories, they have their own personalities, they have their own traumas even, and their own kind of identities within communities. And if we don't understand that, or we don't understand what that looks like, then, just as we want to approach an individual with that thing, neither do we need to be able to do that with congregations or faith organizations or really any other partner within systems of care either. And so, point well taken. I really appreciate that. So one of the things I'm curious about this too, and I'll move to the next slide, but one of the things I'm curious about on this, Michael, is I recognize that one of the things that can sometimes be challenging in trying to have that communication. And I think your strategy of being able to find somebody who really is part of that community, who's already trusted, is fantastic. I think that's really, really important for a lot of reasons. Outside of that, it can also be challenging, I think, to try to go to clergy directly, specifically in rural communities or other places, recognizing that congregations in other places may not always have, and may often not have, maybe more frequently than not, have full-time or even part-time staff who are there set hours of the week for certain hours of the week. And so, if my strategy is to try to go on a Tuesday afternoon at 11 o'clock and to try to meet with somebody, that may work in some congregations. There may be somebody who sits at a desk and who is able to set up that meeting and who's able to have that conversation. But I can think of more congregations and places of faith than not that doesn't necessarily exist. Those buildings are, that person often is, as you said, they're bivocational, they're working full-time jobs, they're involved in other parts of the system of care in other ways. As such, my strategy has to kind of adapt for that. And so I'm curious, if I want to be able to connect with that individual specifically, how do I do so? If I want to be able to connect with a clergy member, I guess I could leave a message, but if I want to try to connect with them in person, outside of being able to go to someone who's already trusted, what are some other maybe strategies that you can think of? And I know this may be a challenging question.
And who is the I connect? Is that the mental health professional, or who's the
Yeah,
I
I'm sorry.
connect?
So if I'm a mental health professional or even just another provider within systems of care, and I'm trying to connect with faith communities and specifically those clergy who may not be in that congregation for 40 hours a week, what are some of those things I can do to still try to have that contact with them?
I don't know that it's any different with, having a brick and mortar and set business hours than if you don't. I think trust has to be built, relationships have to be built, right? And so making those connections in the community, I think Austin's a good example of that for us, is that I'm not from the Austin area, but if I get to build a relationship with someone as a mental health professional, I don't even necessarily identify as clergy anymore. I've not served in a church in a long time. And as a mental health professional, I have pastors, ministers that I know personally, and they are folks that refer to me if someone's looking for mental health services or therapy. They refer to me directly. If I need something, I contact them. So I've built relationships with those folks. And when someone else is looking, they may ask that friend, fellow clergy member about those services, but then vice versa. I might say to a local leader and say, hey, look, this is what we got going on, or I've met a number of people from your community. I really would love to meet some other pastors, some other leaders. Can you introduce me? Can you get me connected to other folks with my services that are there? Or I might say, hey, you trust me as a therapist and you're sending people my way, feel free to share that information with other pastors, other leaders that you know. I think that's the best solution or a strategy, at least for me, just to throw a website to someone or to just throw something at someone. I don't know that goes very far, because, if you think about it, when it comes to especially mental health services, it takes a big step for people to get to that place. And I can tell you within our community, I'll just be honest, is I'm one of very few Black male therapists in the Austin area. If we have 20, we have a lot in the whole Austin Metroplex, licensed professional therapists, right? And so I can guarantee you the number one place that I get referrals are either from Google, or someone goes on and Googles Black male therapist, or they've gone to a faith leader and said, hey, they're at a place where they're willing to look out and they want to say, do you know someone that looks like me that's looking for therapy? I mean, that provides therapy. And so all of that is based upon relationship and networking. I think very little of it is just about my advertising. It's more around relationship.
Thank you, Michael. Cliff, I see you have your hand raised. Do you want to come on, Mike? We'd love to be able to hear from you.
Sure. Thanks for taking my question. We have numerous congregations in the Black and underserved community and in the Latino community that are all part of a coordinated program initiated with champions from different major Black churches and Hispanic churches, where they train their congregants in how to be mental health companions, teach them how to triage suicide, ideation, emergency crisis calls, and to refer them to medical professionals like you. And they daily have newsletters talking about such subjects to their congregants on schizophrenia, bipolar mood disorder. In short, it is something that many of us who are mental health professionals have wanted for years, finding resistance in the Black and Hispanic congregations to mental health education. But here, it's some of the strongest supporters of this are the ministers and the pastors who are welcoming it, because they're seeing so much mental illness in their congregants and we're asking for help. I'll stop and go back on mute right now. Thank you.
Thank you so much, Cliff. I really appreciate you sharing that resource. One of the things I'm curious about, so Mary Paulson, I think, may have had a question earlier as well. And her question, Michael, was, what would you say about mental health professionals who are also members of the faith community? Are there boundary issues, or what benefits do you see with that? Maybe unique challenges that could arise with those kinds of dual roles?
Yeah, before I do that, let me respond real quickly to Cliff. So we just heard that. Cliff, I'm also actually a board member of NAMI Central Texas here, and we do a program called Bridges to Hope that I help Gibbs Initial work towards. And so there's probably some connection there that you and I don't know about that we probably.
That's wonderful. I'm glad to hear that. I used to be on the state board and on the NAMI FaithNet. I'll go back on mute.
Yeah. So maybe there's some collaboration maybe already happening, or that you and I need to initiate to see what we can further. To answer that question, how was it specifically, how do I address it, David? When it comes to dual roles within the church community and as a practitioner, is that what it was?
So I think the question is just that, and also how do you manage those kinds of dual identities?
Okay. So in my informed consent, right, when a client comes and they get to read all of the parameters and boundaries of my practice, one of the statements that's in that informed consent is almost to the word, it says, if we happen to see each other in the community, I'm not going to acknowledge you, but if you acknowledge me, I'm not going to ignore you. And therefore, I'm not going to out you as a client. So that's kind of the statement and how I use it as a practice as a whole. However, I do attend a couple of congregations actually here in the area, and one of them is a little larger congregation. And I've had numerous times where I'll show up at church. We have 3 different services at our church, and I'll show up at service and I will see a client. And I do just that. I don't acknowledge the client. I don't approach them, any of those things. If they acknowledge me or approach me and I'm with my family, I say hello. I still don't tell them that I'm their therapist. However, I have a wife and 2 and 3 children that may be curious. I always tell the client, it's up to you if you want to disclose that I'm your client. I mean, not I'm your therapist, but I'm not going to do that. And so I allow them to disclose that if they want to do that. It's inevitable when you live in small communities that that's going to be a possibility. I think it's just maintaining boundaries and being able to be open with your community about who you are and what you do. But I maintain confidentiality for my clients the best of my abilities. And living in a small community, it's possible that I'm going to run into someone, even to the degree of being on the same soccer team. I have to approach that to figure out what happens when that may happen. I need to take the steps to make sure that there's security in that and there's confidentiality in that. The other is my boys are in the school system, and it's possible that their friends and families might start seeking my child. If I happen to see and it's happened, I've had to see I'm seeing a young man that is connected somehow to my son at the school. My son will never know, nor will that client ever know that they're connected, because relationships started well before they happened. Now, if it gets to the point to where this has to be personal interaction, then there may be a need to look at termination of that client, or finding different ways of interacting personally. So I don't know if that answers your question, but that's how I handle it. Is I'm never going to disclose who I see in my office, whether I see you at church or somewhere else.
So a little bit earlier, you talked a little bit about church websites and maybe not why it's important, maybe not to just go off of church websites. One of the things that I have found, and I'm curious if this resonates with you at all, is churches may not always, and congregations may not always have very strong web designers within their congregations. I think of some of the various congregational websites I've visited even in the last couple months. And it's very, very easy, I think, for us to sometimes look at websites and say, look, like if their website's outdated, maybe they don't really care. Or maybe they're just not very committed to this. And one of the things that kind of stuck out to me on this is just this idea that the value that a congregation brings within systems of care is really not something that should be defined by the quality of the website. And I say that, and I think that's true of any other area. But when I think of partnerships, I think of websites as a great way to get information. But I also think of faith communities as often having maybe websites that often need some redesigning or rethinking, or really could even use some additional support as well. And so, I would just caution, I guess, maybe don't try to decide whether you want a relationship just based off of that website.
Sometimes, right now, because we live in such a digital world, not to mention with a pandemic going on, that's how folks are trying to get connected. So that's where maybe the initial look is. So I think it's important to try to have a good facing website. But I still think, David, it comes back to connecting, right? Because maybe you're right. They don't have the staff, they don't have the ability, they don't have the know-how to do the website or to maintain it. Yet they're probably the strongest partner because they know every person in that community. right? And so I don't know if we should stop there. I think it is just maybe the next step. And maybe that's a place where you connect. If you got a connection with someone that has skills around websites and maintaining those, that might be a partnership with that church to say, hey, we've got a teenager that this is easy for them or whatever it might be. And that's maybe the opportunity for them if that's a need that they have. And so I think not to see it as an obstacle, but maybe an opportunity to connect.
Yeah, and then, a couple of webinars ago, one of the things that somebody had mentioned, and I wish I could remember who it was, but somebody really kind of stressed this idea that beliefs and practices of an individual may not always be the same as their congregation or faith tradition. That, the religion and spirituality is sometimes sort of a spectrum almost, where, yes, I may have certain things in common with a particular faith tradition or a particular congregation, but there's also likely to be things that maybe I differ on or I think differently on, and that I practice maybe to different degrees or in different ways than how wherever I go may attend as well. And I'm wondering if you can think of some examples of what that looks like in your practice as a counselor, and connecting with people where, yes, if I were only to look at a psychosocial and I said, hey, this person believes this based off of claiming a certain faith tradition, but not really understanding them, I would think this. But if I really got to know that individual, who they are and where their faith or spirituality is actually, quite a bit different, or that there's certain things that maybe mean more to them in certain categories or certain factors, that by me being able to understand, allow for me to build that better rapport and allow for me to be able to be more supportive of that individual.
Mm-hmm. So if I understand you right, the question is, what does it look like how do I approach it when individuals are maybe either a different practice as myself or even want to or not bring that into the practice?
Well, so maybe for themselves, but also how do you approach it when the individual of the faith or the individual's faith may be different than that of their congregation or their faith tradition? And I guess maybe we even find this a lot in adolescence where, yes, there may be adolescents and teenagers who are going to a congregation because their parents say, hey, we need to be able to go to this place on such and such a day at such and such a time every week. But, for me, otherwise, or for the adolescent otherwise, where they actually believe or what that actually matters to them may be different than what it could appear on paper otherwise.
Gotcha. Yeah. So I think there's two things there. One, if it's an adult, it's likely that they may not even be in the practice, right? So they may come from or have a history of a specific practice, but they may have chosen not to follow that. And so there's not a whole lot of conversation there. However, it may be tied to some of their trauma, it may be tied to some of their challenges they're experiencing. And so the level that we explore that depends on what the person brings in with an adult. More frequently, I see the other option that you gave is when the young person is experiencing whatever challenge it is, but part of that challenge is that they're evolving in their own belief systems and worldviews, and it will and probably should contradict their parents because they're trying to develop what their own are. And so what do I do with that? I am a very strong believer in holistic and family therapy. I may have an identified client as a 14-year-old individual, right? But the reality is that I have a conversation with that young person and their family is, if I'm lucky, I get an hour, if even more, an hour and a half with your child, maybe once a week. When they leave my practice and their session, they're now in the hands of their parents, their community, and whomever that might be. And so I think the best option for that young person is, how do we include your family and community into your wellness? And so having the conversation with that young person is, hey, I'm having a battle with, I don't really believe what my parents believe, and I'm having to get pushback on that, is helping them begin to identify what is their belief system. At 14, 15-year-old, they're supposed to be developing in that way and learning what they're, who they are and what they're about and how they view this world. So I help talk them through that process and figuring out how do we explore that and figure out what that is. But I also help them understand that you've got to connect with your parents. They are your parents, and you continue to respect them outside of there being harm to you. And so how do we bring the two of you together to have a conversation about faith, about your mental health challenges, whatever it might be, because they are going to be a part of your life, even if I'm not as a therapist. And so we have a conversation with everyone to figure out what does that look like. If the young person is my identified client, we help them see the need for respect, the need for honoring their parents, all of those different things. But at the same time, have the conversation with the parents of your young person is supposed to be exploring their beliefs. They're supposed to be exploring their identity, all those things. And it will likely contradict to some degree yours. How do you help support in that development as opposed to it becoming a fight against who they are? Because we know with young people, there's going to become rebellion. If everything is, my parents are against everything that I think or believe, they're going to run to where acceptance is. And so it's helping equip parents at the same time to how to listen, how to communicate, and help walk alongside their young people in that process of development, including their spirituality, right? And helping them see what it is. And so if it's a fight against them, they're going to run to what's going to be accepting to them. And so it's partial education and equipment for the parents, as well as for that young person to figure out how do we learn how to have a conversation around their faith practices, and helping the parents understand I'm not contradicting or going against your faith practice, but how do I help equip you to listen to your child and hear where they're coming and help them develop their belief system.
Thank you, Michael. So we've talked some about considerations for mental health professionals and other providers. One of the things I've also heard you mention is simultaneously, it can be important for, there's oftentimes where clergy and faith leaders may also be reaching out to mental health professionals and other parts of the system of care to try to figure out how to best meet those needs. And I'm wondering, when you think of what it looks like to engage with mental health professionals, I recognize that a lot of our counselors, specifically in the public system, are, extremely overworked. They have large caseloads. They have a lot of things they're trying to handle. There's a lot of, even just being able to do simple documentation takes a lot of effort when everything else is going on. And at the same time, if I'm a faith leader who has this idea of things that I want to be able to do, it can be difficult to maybe engage with mental health professionals, just in the sense that, again, those mental health professionals are often busy, and those organizations often maybe already have things planned out for some period of time. And so I'm curious if I'm a faith leader, or maybe I'm even a lay leader in my congregation or my faith community who wants to be able to engage those mental health professionals, what are some of those steps I could do to be able to begin that conversation going in the opposite direction of what we've already kind of talked about this morning?
Well, I think some of this is listed, but I think it is the finding ways of being involved in the community that's already addressing these issues, right? And so whatever organizations that are out there, and there's numerous, and we've even named a few, but how do I get involved in what's already happening as a lay leader, or even as a faith leader within that community? Sometimes it's getting the blinders off of only things happen within the confines of my congregation or my faith community. And so figuring out how do I get engaged and how do I get involved with what's already working, and how do I help influence those organizations? And so I think it is collaboration, right? To be able to get to a place to where what's available, right? As a clergy or faith leader, what is in our community? And so that's private services, it's public services, organizations that are doing the work and are already connected to people, being a part of those, whether it's volunteering, board membership, any of those things, maybe even working in some of those organization agencies, so that you're aware of what's going on, right? As I think it's lack of education happens on both sides, is we don't know what's available. And so to take down some of the hesitations or lack of awareness is being involved, and so that that what is offered. I know we mentioned NAMI, and this is not an advertisement for NAMI, but it's getting people to a place to know what's services that are provided to me and my family that are in need, but how can I also give back to the community and be able to educate and bring awareness to what is available and how people can live healthy lives. And so being a part of that is huge, and being a part of that, you're influencing that organization or agency, but you also begin to build relationships that you know that when you're doing a connection, a referral, any of those things, you're doing it to a trusted entity. So being involved.
Yeah, point well taken. I mean, I think it's not necessarily if families and youth are going to be able to, or it's not a question of whether they're coming to you for those resources. The question is, when are they coming to you? And when they do you have that kind of list and that knowledge already there? You know, I know of people who, I can think of clergy who still use Rolodexes because it's their way of organizing you know, the relationships that they have, so that when there's a question, they are automatically able to pull up those resources. And I don't know that it has to be a Rolodex. It could be a number of different things. But I mean, just being able to have a one pager or something else that, you know, hey, these are the resources I have available. These are the people who I can contact. This is how to contact them. These are, you know, I think there's a lot of confusion even times about who's an appropriate referral for this. And so just, you know, not even being able to understand just that this agency offers services, but what services do they offer? Who's eligible for those services? You know, are there certain things that are also important to consider for that, so that I'm able to ensure that my referral isn't just to a mental health professional or a organization, but that I'm really being able to be specific in where that referral is going and able to ensure that it's something that can really be followed through on. And, you know, I think one of the things I really appreciate about what you said is your emphasis on relationship there, that yes, I could theoretically make a referral as a clergy member at any time. And I could do that. But if I have a relationship there and I know that I can call Tom at this organization, and Tom and I get together even every 6 months for coffee. And I know that Tom is doing this, and these are the new things the organization is doing. My ability to be able to contact Tom increases because I'm more comfortable with it. I have the relationship there, and I understand what it is that Tom is currently able to do within this relationship, as opposed to it being, hey, I put together a contact sheet, but maybe I don't know these individuals. This was what I gathered off of a Google Doc, rather than, you know, something that, you know, really kind of had that holistic system of care approach.
You know, David, the thing I think about when you mention that is I oftentimes call a person's counselor friend. Yeah, I have this counselor friend, Michael, and there are many faith leaders that will call me, and maybe they're not seeking my services directly, but they're doing exactly what you just stated is, hey, Michael, I have this situation and I'm not quite sure what to do with it. Is this something that needs to be referred to a licensed professional therapist? Or is this something that we maybe just need to find services for them? It is just simply giving them information about what to do next. And so it isn't always seeking my services. It is being able to have a trusted individual to call and say, hey, I don't know what to do as a faith leader. I don't know who to connect these folks to. I do realize that it's outside of what I can do, but I'm not sure where I should go next. And so I think that's great to have, but then to be able to either give to them or them to develop, all right, if it is, hey, they need maybe assistance with electricity or whatever it might be, here are those resources to be able to connect to those things. And so building, it still comes back to relationship, right? Knowing that I can call someone and say, hey, this is, I trust them to give me the appropriate information.
Yeah, no, absolutely. And then I mean, again, I think just being able to follow through with that. A referral isn't the stopping point. The referral is the starting point for being able to ensure that service and those supports are able to be provided in a way that continues to be able to meet their needs. And so, you know, it's not, a referral is not, hey, I am done with this, I'm washing my hands, no responsibility, I'll see them on Sunday again, or Saturday, or whatever other day of the week that faith tradition celebrates. But rather that this is really a starting point. And so, you know, I think faith communities, they want to be able to be involved in those processes. You know, most of the clergy members I see don't want to necessarily make this referral and that be the end of the relationship. That's fine if that's the case, and they're comfortable doing so. But if that individual is part of my faith community, they're there, they have an investment. In particular, I want to be able to follow that individual. And so if there's opportunity, and again, this is based on the individual and their family and their desires, But if there's opportunity for that faith leader to be able to serve on a wraparound team, or there's opportunity for that individual to be able to participate in work groups within the mental health organization, or there's opportunity to be able to even just gain additional assistance around what are our referral policies within our congregation, and can we kind of formalize when we make a referral or how we do that, and can we make sure, I mean, even things around mandated reporting, I think are sometimes things that are really confusing to congregations to know when to do it and how to do it. And so if I have the ability to be able to be involved in those types of processes, and I know that I can do that again without judgment and in the support of relationship with those mental health professionals, then I want to be able to do that at the same time. And so, yeah, I think just that point that referrals don't have to be the stopping point. They're really the beginning point.
Yeah, I would agree with that. I think it's the other thing is when you were talking, made me think about was some of this depends on the size of the faith community, right? And sometimes we automatically think of, lead pastor or rabbi or whoever it might be. And the reality is they have a gazillion things that are coming to them. And so sometimes they're not the person, right? They may obviously have influence, but they might not be the person. And sometimes that's who we always are trying to go after is that identified or the face of that community. And so it's learning who in that community is influencer and how to get them connected. Those are the people we also need on committees and volunteering and doing those different things. And I think the other end of that is, I think there's a level of relief when a leader or people in the community can know that, hey, I'm doing what I can do in supporting this family, but there's some things I just don't have the capacity or the ability to mess with, but I want to be able to trust that whoever I've connected them with is going to handle them well. And so I think it's building those come back to relationships, but being able to know, hey, I've sent them to Michael and that part of their life is good, they're taken care of, and I can just be pastor, I can just be friend, or I can just be whatever it might be. So there's a level of relief that comes there that you are able to offer something that maybe they can't or are unable to do.
Let me just ask, Michael, when you think through some of these conversations, are there any other things that you would just say, hey, when you think about these partnerships, these are the things that are really critical. I know one of the things I've really heard you say and appreciate is that emphasis on relationship.
I think the only thing that comes to mind is, like you kind of mentioned, I think it was in one of your earlier slides, is if, like, just say for something like system of care, you're trying to connect and engage a faith community in the work that's happening, is I think people need to know how it benefits them and how it benefits the people that are participating in their community or faith practice. There are so many things that get bombarded to communities that we need to be at a place where it's helping bring support and maybe a level of relief, as opposed to feeling like it's another burden, right? Here's one more program, or here's one more meeting to show up to, or one more whatever it might be, as opposed to being able to see how something might benefit not just them as an individual, but their community. I think that's huge. And so having some along just for the sake of having a partnership or a network, I don't know how far that goes, but having a level of mutual benefit, I think is huge. And being able to try to communicate that and being okay with saying, all right, maybe this isn't a connection. How do we allow somebody else to be a part of that? So, I mean, it's the only that comes to mind that I would probably add that we haven't said.
Great, thank you, Michael. So we'll open it up for question and answer. I see Angela just provides the comment. She says, my research says that people automatically go to their religious leaders for support. So they need to be equipped, and that this is the current reality.
I'd agree. They do need to be equipped, and offering and providing training, information, all those different things that are going to be appropriate. It's an ongoing process that needs to happen.
The hope of this webinar is related to, in this series, is to really kind of provide some of these conversations and try to create some space for these conversations that may not always exist. So recognizing that, again, there are often barriers within systems of care that may prevent mental health professionals from being able to reach out to clergy and faith communities, and vice versa, faith communities feeling comfortable being able to reach out to mental health professionals. I think the hope of this platform is really just that it provides a space for some of those conversation and really allows for us to be able to explore some of those opportunities for what that looks like within the context of system of care. And so I think brainstorming can absolutely be a portion of that for sure.
Okay.
And so, if there's things that you would recommend or there's things that you see in your community, I think it's great for other people to be able to hear that.
Okay, so I do have one additional comment / question. There are huge arguments about blending or merging psychology with the Bible or the all sufficiency of God's word. And I'm speaking from a Christian perspective. And so I think that's a huge barrier right there. Like not understanding the value of the body, mind, spirit, soul connection, right? And how God's word, or just the standard of truth and universal truth may actually agrees with God's word, because God is the author of all truth, like truth. And so how do you speak to that? Or, because I think that's a big issue, like an A1 issue.
Yeah, so a couple things that come to mind. One of the things I have come across in the last week or so is there's a report, and I'm going to try to find it here in a second. But there's a meeting that SAMHSA gathered, actually. I think it was SAMHSA. It may have been another government agency. But around 2005 or so, maybe 2008, there was an organization that brought together a lot of leaders from different faith communities. And they had some of this conversation about what does it look like within our particular faith traditions to be able to address suicide prevention. And so this included statements from Hindu and Buddhist and Islam perspectives, as well as Judeo-Christian, Mormon perspectives, others, who were able to say, for us, these are sort of our faith tradition's official statements on what suicide prevention looks like, as well as how we understand mental health and suicide within our communities. And I think one of the things that was really beneficial through that conversation, from what I can tell at least, is that it really allowed for kind of a starting point for exactly what you're talking about, I think, for, what are those understandings? Where do they originate from? How do we talk about those? And at the same time, are there points in which we can still kind of come together? And I think one of the things that this gathering sort of showed at that point was that, yes, there's a wide array of different thoughts and beliefs about suicide, about mental health, about mental wellness, about substance use. And those things often held a lot of personal value. And I think also what it showed at the same time is there were also some strategies and approaches that could be utilized that, one, were specific to those faith communities, but also could be found in common with other faith traditions as well. So that in total, yes, there may be those differences in beliefs, but that some common strategies and approaches could still be identified through that. And so I don't know that this hope is necessarily for this platform to be able to say, hey, this is how we should work specifically with individuals who hold this belief about mental health. But I think, that at the same time, I'm hopeful that at the same time, this provides a space for us to be able to talk openly and to be able to say, hey, this is an area where I see my faith community could use more support around mental health. And these are the things that I wish were available, or these are the types of resources that I wish existed.
So Angela, that's a great question. And I appreciate Michael for this. His information is awesome. Something that I'm going to relate to other pastors. So I'm a senior pastor, and I'm also a registered nurse. I have worked in emergency rooms, and then I decided to go to the jail and prison system, where I really was exposed to mental health and in opioid and So for the 3 years ago, just before actually 2 years before the pandemic, I was called to a coalition in Tampa Bay to see if we can educate and prepare the clergy in what we call it the clinical. It was a kind of bridge clinical and faith. And I was called because as a pastor, I understand faith a little bit. And also as a registered nurse, I understand a little bit about science too. So it was two things that we needed to identify. The first thing it was that why we needed to go to the clergy and tell them, because there's nothing more than an eager pastor, feeling that he's being told to do something, right? How many relate to that? But the thing is that the need for reduce the stigma within the faith community on mental health, on addiction, on recovery. So as a pastor, I was called to be part of this coalition. It was a huge participation of clinical saying that they're trying to knock on the doors of the churches, but they're not opening the doors. So as a pastor, I was also, trying to bring this to a balance by saying, what's the approach? What is the approach to the pastor? What is the approach? And so what I decided to do was test the clinical with my own people, with my own needs. So when I started referring some of these individuals that I'm taking care of, issues that have come up recently, I realized that there was a lot of areas that needed to be addressed by clinical before we actually go to a pastor and put our names, our agency names, or if you have a problem with one of the members, listen, because I went through some of that. And I told them before we actually go to the clergy, we need to get our act together and what kind of resources we offering, and are we going to provide not only, but we're going to really be the help that you saying you're going to be, and that we're going to really perform. And so we needed to do some adjustment in the clinical, but at the same time, I said to them, I would talk to pastors directly from a clergy to a clergy, a faith leader to a faith leader, and I want to know what also they're saying and what, and then we come to resolution. So the idea was to during the coalition prepare forums, like 2 or 3 forums a year, every 4 months, and bring the clergy, bring the clinical, and just hear each other and begin conversations and provide information and things like that. And they were the first few were successful. The problem we encountered was that is the interest from a lot of the clergy to learn more about mental health and behavioral health and addiction and recovery, and very few like myself that understand the recovery's different pathways, and that I can consider MAT depending on the individual case. You see, we cannot cut everything, not one model fits all. But the thing is that we're never going to, as a clergy, we're never going to compromise who we are and compromise our values. But when we said we are a faith-based center, even though we believe in, as a person that worked in both sides, it was only a few that were in the interest, because we wanted to know why they were not in that. It was not part of the agenda, or it was also insecurity from the clergy standpoint that they cannot talk. They don't talk about that. They feel less power. They feel insecure about talking because they don't know much about the subject. But we also told them that the less we talk from the pulpit, the less the people will open themselves too. And so I begin to have in my church people coming from other churches to talk about a lot of those issues. And that was not the idea, by the way. And so the pandemic came, a lot of issues happened, and we're going to reorganize that and learn lessons, what we will learn, what positive things we learn, and what things we need to adjust. And we're moving forward. In 2022, we're beginning a new mindset on how to bridge science, the clinical and the faith. And it's not easy, Angela. It's not going to be easy because, again, we thinking we can reach out to a lot of pastors, but we cannot thinking the ones don't want to come to those forums. We have to really invest in the one they're really interested.
And that's been my experience in my work with trying to bridge the gap, so to speak, or bring the whole person. That's been my exact challenge, past, present, and I believe future too, as I try to go across the country and help bring change in this area.
And someone said about equipping pastors and things like that, like, it probably help them with mental health first aid training, trauma-informed care, motivational interview, peer specialists, to try to utilize peer specialists, because I believe that the senior pastor cannot do it all, and hopefully that person don't think they can do it all. But once we, as myself, I consider that's why it's important to know your gifts and talent, do an assessment on what is your gift and talents, what is your strength, and have one of those surveys done on spiritual gifts. Is that I find myself in a classification that I'm good on taking care of the crisis on calm the storm, but I'm not good on maintaining. So I have to refer to someone with gifts and talent that they have more about a caring, the kind of care ministry, that they have more patience, they have more, they show more empathy, compassion, and things like that. But we cannot do it all as senior pastors. So what I do is I refer what we in the spiritual world we call it witnesses that already gone through certain experience in life, and now they can speak to some people that are going through those issues and struggling. Well, in the kind of clinical is peer specialists. And so what we do is that once the crisis is kind of being taken care of, the best thing is to pass it on to someone that can never can drop the ball, because it's important to following up on people, caring for them, finding if they're going to their appointments, to their referrals, and it's a constant, it's a relationship. If, for instance, that if I have someone that just left jail, that was discharged from jail, and they have to visit the probation officer on a monthly basis, I don't want to use just a driver, because most of these individuals come with a lot of needs. Transportation is one of them, housing, and more. But I don't want to just send a regular driver to take him maybe 45 minutes. I'm in a rural area, so 45 minutes to a probation officer, that's valuable. That time is valuable. You better have a peer specialist that knows what that person is going through, been there before, and have a very effective conversation on the way there and the way back. That is using time, to the best.
As a pastor, finding yourself in a situation where your heart really was to do more, and that you needed to step away from pastoring and gain the knowledge and skills and the training to be able to do what you're doing now. I think that we each, as congregants and as community leaders and providers, have a responsibility to figure those pieces out for ourselves. And if we're not part of a faith community, maybe exploring what faith communities are doing. And those of us, such as myself, in a faith community, how can we partner with those that are in the community that have the skills, the knowledge, and the ability to provide services such as you have with your group there, Michael? It's not about separating ourselves from each other. It really is about coming into relationship to make a difference, to see people's lives improve, to see people healed, to see people get needs met. You know, when somebody needs a doctor because they need a heart transplant, or they need to find out what's going on, that they're not feeling well, we encourage them to go to the doctors. We need to do the same and understand, and I know I'm probably preaching to the choir here, that when it comes to our emotional and mental health, we need a doctor, we need a clinician, we need a therapist. Faith is important, and it certainly is the crux in which I live my life and hang my decisions on. But we need to help by being part of the answer, and that is in educating those around us, whether it's educating the people that we work with in our vocation in the mental health field, helping them to understand the role of faith in faith communities, or if it's us in the church, helping our congregants and peers to understand the role of mental health and community services. Thank you so much.
Thank you, Charlotte. I see Cliff, you have your hand raised. So we'll have Cliff speak, and then we will close.
I think what is transformative here in San Antonio is you have a number of pastors who are highly respected and loved by their congregations, who've acknowledged that they themselves have had mental health difficulties and have openly spoken about maybe having had depression, anxiety, and family members. And that in this movement here in San Antonio involving mental health first aid programs for the congregants, how to be better pastors to people with mental health, get them to experts like Michael. It's been very transformative because the pastors personally have bought into mental health education as professional mental health education as a means to help their congregants who are going through the hell of, if every 1 out of every 5 people in the world suffer from mental health illnesses, that how needed it is. But that's what has helped here in San Antonio is the buy-in of Black pastors and Hispanic pastors in their congregations. Somebody is also on this who knows more about the Bridges to Care program in San Antonio than I am. She's placed some excellent comments in the chat.
Absolutely. Thank you so much, you all. Really appreciate the conversation. We're going to go on and get ready to close. Michael, I wonder if you have any final words or thoughts. We've heard from quite a few people this morning on, what this looks like in their communities. And I'm wondering if you have any closing thoughts for us.
No, I just appreciate being a part of the conversation and excited to see the different work that's continuing to happen. Maybe the one encouragement is maybe at this point I've had the chance to do, vocational ministry, working in the mental health field in a number of different ways and arenas. The beauty is I feel like I'm finding my niche, right? I feel where my places of influences are in the faith community as well as the mental health community. And maybe I just challenge folks to do the same. Sometimes systems level can get overwhelming, right? When we see we're going to change the world, My approach sometimes is, how are you changing your immediate community that's going to influence the world, right? And so whatever your faith practice may be, the community that you're a part of, start there. Start doing that work and see how it influences the greater capacity. It can become overwhelming, and really sometimes we can maybe get a little jaded if we are afraid of the system doing what it's supposed to do, as opposed to really thinking about what kind of influence can I have where I am and see what that does to expand. And so it's more of a challenge, I guess, is just to know what your area of influence is and how are you affecting the change and the connection between mental health and your faith community where you are.
Thank you so much, Michael. I so appreciate your willingness to share this morning and for joining us in this conversation. Thank you also all for attending. If you have any other questions, want to connect with us, we'd love to be able to hear from you. You can contact us by email, call us. If we have a website, of course, feel free to also, if you have a specific TA request that you would say, hey, when I hear these conversations, these are the things that I really wish existed in my community, or I really would like to know more about fill in the blank. You can request TA. Would love to be able to support you in some of that. And then also feel free to connect with us on social media. We do have a Facebook, Instagram, and a Twitter. Thank you so much, y'all, for joining us.